Good evening. Welcome to the Iyer Clinic video series on medical topics. Every day at the clinic, we frequently get patients who have some question about one medical topic or the other, and they frequently bring articles from Google and other sources. And so we figured that it's better for us to actually concisely condense most of this information and start showing these videos on one topic at a time at very regular intervals on our website and on our Facebook page. So here comes the first of the series of the Iyer Clinic Medical Educational Topics. Today we'll be talking about dizziness and how our bodies maintain balance. Dizziness and vertigo is one of the most common presentations of medical problems that we see in the primary care setting. And consider this. You get up in the morning and suddenly the whole room spins around you. Every time you move your head, everything seems to go awry. And when you take a few steps, you may even stagger and have risk of falling. You're nauseous, and you may even throw up. This is scary to most people. However, 9 times out of 10, dizziness occurring in the primary care setting is usually of only one type, and that is known as benign positional vertigo. 99% of the cases that we see in the office are benign positional vertigo. What is benign positional vertigo? In our ears, we have 3 semicircular canals called the labyrinth. These semicircular canals are there in the right ear and in the left ear. They are part of the inner ear. You have an upright semicircular canal, a horizontal canal, and one that goes along the diagonal axis. If you notice the orientation of these canals on the right and on the left, follow the pattern of an X, Y, and Z axes, essentially giving the 3 coordinates of space in a 3-dimensional structure. Now the beauty of this system is that inside these canals there is a section of this that I have drawn in this illustration, enlarged and magnified. There are millions of tiny hairs shown in these little green hairs are there. And inside these canals, it's partially filled with liquid. And so when the body moves, the liquid sloshes around from one side of the canal to the other. At the base of each of these hairs is a tiny nerve fiber that goes to the brain. And this nerve fiber fires. Electrical activity translates along this line to the brain, and this is the electrical signal that the brain receives in stereo from the right and left together. If you were to consider all the movements an Olympic diver or a gymnast does, imagine he spins, twists, turns, and then at the right moment straightens out and goes into a clean dive. Or the gymnast straightens out and sticks the landing. All of that is controlled by the brain acting on the stereoscopic signals that it receives from its labyrinth. A billion computations per second is going on in each of our brains that enable us to make balance. But consider a situation where one of these labyrinths get inflamed, and most of the time it's a viral labyrinthitis. Itis means an inflammation. And when that happens, this inflamed labyrinth, for the same amount of movement, will produce 10 times the signal to the brain as the normal side on the other side. And this asymmetry of the signal coming from one side to the rest versus the other side produces an asynchronous signal to the brain, and that confuses the brain, and therein it produces vertigo or dizziness. The process that we know as motion sickness and seasickness is all vertigo due to position. And though motion sickness and seasickness does not require an inflamed labyrinth to occur, but the process is the same. It is usually violent, persistent movement that the brain is not able to handle, and therefore the subject feels dizzy. The treatment of dizziness almost usually involves certain drugs such as dramamine, scopolamine, or meclizine. Meclizine is by far the most common medicine used in the outpatient practice, but please do not self-treat. There could be many other causes of dizziness. Even though 9 out of 10 is of the benign positional vertigo, it is your doctor's job to decide what it is and what should be done for it. So please, if you are dizzy, call your doctor, schedule an appointment, and see him, and have him test you and determine that it is indeed BPV. I hope you found this brief video informative. Join us once again when we post our next video on our medical information series. Thank you for watching the Iyer Clinic videos.